Why NSAIDs can be dangerous for your kidneys. Hello everyone, I'm Dr. Christopher Brennan from LongIslandAftercare.com, and today we're going to talk about something that millions of people take every single day without realizing the potential risk to their kidneys: NSAIDs. NSAIDs, or non-steroidal anti-inflammatory drugs, include common medications such as Ibuprofen, also known as Advil, and Motrin, Naproxen, also known as Aleve, Diclofenac, Meloxicam, Celebrex, also known as Celebrex. Now, don't get me wrong, these medications can be very effective for treating pain, inflammation, headaches, arthritis, sports injuries, and many other conditions. But here's the important part. When taken in excess, for prolonged periods, or by people who are at higher risk, NSAIDs can cause serious kidney injury. So let's talk about why. Your kidneys are incredible organs. Even though they make up less than 1% of your body weight, they receive about 20% of your body's blood flow. In order to work properly, your kidneys rely on tiny blood vessels called afferent arterioles that deliver blood into the kidney's filtering units. Normally, your body produces chemicals called prostaglandins. Think of prostaglandins as the kidney's natural helpers. They help keep these blood vessels open so that blood can flow freely into the kidneys. Here's where NSAIDs come in. NSAIDs work by blocking enzymes called COX-1 and COX-2. These enzymes are responsible for producing prostaglandins. So when NSAIDs block COX-1 and COX-2, prostaglandin levels decrease. The blood vessels feeding the kidneys begin to constrict or narrow. Less blood reaches the kidneys. The kidneys receive less oxygen and fewer nutrients. Filtration slows down, and in some cases, acute kidney injury, or AKI, can occur. Think of it like a garden hose. If you pinch the hose, less water flows through it. The same thing happens in the kidneys. When blood flow is reduced, the kidneys can't effectively filter waste products from the body. Now, some people are at much higher risk than others. This includes people who are over age 65, are dehydrated, take diuretics, also known as water pills, take blood pressure medications such as lisinopril, losartan, or valsartan, have chronic kidney disease, have heart failure, have liver disease, or are recovering from a serious illness. In fact, doctors often talk about something called the triple whammy. That's the combination of an NSAID plus a diuretic plus an ACE inhibitor or an ARB. When these three medications are combined, the risk of kidney injury can increase dramatically, but reduced blood flow isn't the only problem. NSAIDs can also cause sodium and water retention, swelling in the legs, elevated blood pressure, worsening heart failure, high potassium levels, and chronic kidney damage when used excessively over time. In some cases, NSAIDs can even trigger a condition called acute interstitial nephritis, which is an inflammatory reaction inside the kidney itself and may require medical treatment. So what can you do to protect your kidneys? First, always follow the recommended dosing instructions. Second, avoid taking NSAIDs for prolonged periods unless your healthcare provider specifically recommends it. Third, stay well hydrated. And finally, if you have kidney disease, heart failure, liver disease, or take blood pressure medications, talk with your doctor before regularly using NSAIDs. And remember, just because a medication is available over the counter does not mean it's risk-free. Your kidneys work 24 hours a day, 7 days a week, filtering your blood and keeping your body healthy. Take care of them. I'm Dr. Christopher Brennan, and if you found this video helpful, please like, follow, and share so more people can learn how to keep their kidneys healthy. Thanks for watching, and I'll see you in the next video. Please follow Long Island Aftercare on our social media platforms for ongoing educational videos, healthcare updates, patient resources, and new content. YouTube, Facebook, Instagram, X. Thank you again for watching, and thank you for being part of the Long Island Aftercare community.